Hey everyone, we are back with another episode of Behind the Counter, where today we are quite literally behind the counter. This is a nice little background here. This is what goes on here at HB Pharmacy every single day. And we have with us John and Sheldon, who are both pharmacists, to talk about a common question that actually literally the other day I called Sheldon over to talk with a patient about it. We were talking about different sleep remedies, and as it relates to sleep, stress, anxiety, are there differences between different stress, anxiety medications? Do they work differently for different people, that kind of stuff? So we thought it'd be a cool topic to talk about as an episode in this season. So let's get into it. What do you guys think? Is there a difference? Or let's start. What are the major prescription medications that people use?
So the question that you asked me the other day was regarding a customer that was taking an anti-anxiety medication,
right,
which can be used for stress, anxiety, and even to help someone sleep.
Right.
She was concerned about a side effect about her particular prescription, and fortunately there are a lot of medications that are in the same family that she can try that will have the same effect, but she might not have that same allergic reaction to.
Sure.
So that was what we were discussing, and I think I was able to give her a suggestion to bring up to her doctor and try and switch her.
Sure. So what are those typical medications that a doctor would prescribe in these instances? And anyway,
in her particular situation,
what was she getting?
It was a medication called alprazolam, or otherwise known as Xanax. Super common, probably the most commonly prescribed medication in this class, which is, the fancy title is benzodiazepine.
Right.
So that's like the long
Big
chemical
word.
name for it. Yeah.
Big word. But essentially anti-anxiety,
exactly, basically,
stress, if you want to call it that.
Perfect. And those are divvied up into three main categories, which are long-acting, intermediate-acting, and short-acting.
Okay.
So she was taking Xanax, which is an intermediate-acting one. It usually lasts like 6 to 12 hours. It doesn't go, all the way the entire day, but it's not a very quick-acting one, which is more like 3 to 8 hours.
Okay.
So since she did have a side effect to that, there's another medication in the intermediate family called clonazepam, which is what I had mentioned to her. Perhaps she wouldn't have an allergic reaction to it, but it still may have the same benefits for her.
So what are all those you mentioned, let's list them out just in case people are curious. So the long-term one, intermediate, and short-term one.
The most common long-acting one is diazepam, otherwise known as Valium. And then there's a few intermediate ones that are super common. That's alprazolam, clonazepam, there's lorazepam as well. And then there's one that's almost exclusively used for sleeping, which is temazepam. Is that right?
Yeah.
Okay.
I have sister Pam as well, actually, but that's neither here nor there.
Yeah.
And what about the shorter acting ones?
And then there's really only...
Lorazepam is pretty short acting.
Okay,
right?
yeah, I guess lorazepam could be somewhere in between.
Yeah,
and then triazolam as well.
Triazolam.
But
usually that one we see more for sleep than for anxiety.
Gotcha.
Right? Would you
Agreed.
say? Yeah.
So what's your take on those, just anecdotally? I mean, those are commonly dispensed medication. Some of them are controlled too, right? Or are all those controlled, I think?
Almost everything we just talked about is controlled, I would say, honestly. So,
every single one.
which just means that, you have to be extra careful with it. So, listen, I think that when you're talking about benzodiazepines, I think they have a place in treating anxiety. Typically, what I prefer to see when we're talking to practitioners and patients is you have to kind of, if there's a situation going on and somebody's in an acute situation where they're very stressed and there's something going on, well, good idea to start at benzo, right? But so one of those that Sheldon was mentioning, like the alprazolam or one of the other ones that we mentioned. But you also probably should go on drugs from one of the other classes that we haven't gotten to yet, because those drugs typically take a little while to kick in, and they're safer long term, because I think that everyday regular use of a benzodiazepine can actually end up just complicating and compounding the anxiety problem.
For sure.
Okay, interesting. So what are some of those other ones that you guys see doctors prescribing frequently that you recommend in that sense?
There's one medication that is called hydroxyzine, and it was initially used to treat allergies, but then when people took it, they realized that it also was helping them feel more relaxed and oftentimes drowsy.
Interesting.
So then now it's used for that purpose as well.
So, yeah, sometimes and the brand name on that one I think is Vistaril, but
Correct.
It's actually used now probably more for those types of things, either anxiety or even as a sedative sometimes, than it is now for allergies. So it's interesting, but that works very well. We also see drugs that people know very well, like things that increase your level of serotonin, things that are drugs like Prozac, right?
Correct.
Or fluoxetine is another name for it.
Yeah, they're technically in the antidepressant family, but they can help with overall mood, and I would consider stress and anxiety as a subcategory of your overall
Right.
mood.
The categories very much overlap. Your stress, anxiety, depression, all these things can overlap. So sometimes you see medications that were prescribed originally for some other purpose, but you see now that they're having use in these other various disease states, if you will. So whereas something you might say is if somebody's in an anxious situation, sometimes a medication like a Prozac or a sertraline, which is Zoloft, might also be used. Another medication that's used commonly now is Wellbutrin or bupropion. Also very good to help. Again, those are things that are not for an emergent situation, like they're an immediate need. Those are the type of things you take, and then hopefully in 3 to 4 weeks you're going to start to see a difference, as opposed to the things like the alprazolam, which are excellent for if there's a situation that you need to have some relief right away, that minute, that day.
Now that you mention it too, you're mentioning some brands and generics. Is there a difference between the brand and generic? That's a question we get here all the time. Is there a difference between the brand and generic, or I want the brand, not the generic? The generic's not working, the brand works, something like that.
I have to tell you, I feel very comfortable. I think everything is, where it's made and where it's sourced. So we try to be careful about where we're getting our generics from. I think that said, and knowing, okay, well, if you're buying the generics carefully and you're making sure about the manufacturers and the source, the country where they're being made, then I'm very comfortable with using generics and as a rule. With maybe some specific exceptions here and there. I might talk to a patient about sticking either with the brand or generic on certain drugs and not flipping back and forth, but for the most part I have no issue with I don't know, how do you feel on that?
99% of the time there will be no difference that you can feel because the active ingredient is identical. It has to be per the FDA. The only ingredients that change are the ones that determine the shape, the size, the color.
Sure.
So that doesn't actually affect how the medication is working in your body.
Okay. So what about, we talked about a lot of different medications that work in different ways. What about on the side effects side of things? What kind of side effects do you guys typically see and try to counsel patients on? And also, what of those side effects, I guess, how does that impact sleep too? Sleep is kind of another underlying thing. Stress, anxiety, sleep, like you mentioned, they're all intertwined.
Yes.
Yep, that's true.
How does this impact that as well?
The first thing I think is that's most important to touch upon is that the benzodiazepines, they are controlled because of their potential for abuse and addiction.
Sure.
So although that may not be considered a true side effect, it's definitely something that should be known, and which is why John was mentioning they're good for a short amount of time, whereas the other ones that are not controlled can be used for a longer duration. So that may be one thing to mention as a side effect.
Sure. How about on the sleep side of things?
Well, I mean, in the sense that they can help you sleep, or that they are making you sleepy, and that's causing
both.
Either or,
Yeah, they can actually do both.
Yeah, so depending on which ones you're taking, and a few sometimes, I find that some of the medications, particularly the ones that we find that increase serotonin, like we talked about fluoxetine and sertraline or things like that. I can have somebody tell me they can't take it at night because it keeps them up all night, and then I have some people that tell them it knocks them out, so they can only take it at night. So I really find that with a lot of these things, you really have to sit down, have a conversation with the patient, which is what we like to do here, and make sure that we go back and forth about all their different options, because we want to know how they're doing on it, especially if you're starting something new. It may be the right medicine for you, but even just the time of day might be the problem with when you're taking it. So
yeah.
And
keep
also
the doctor in the loop as well, obviously.
Absolutely, yeah.
And everybody's body reacts differently to each one of these medications.
Yeah, so it's interesting that way, but
so
it's
it
very
can be
true.
a case-by-case scenario.
And we're a little bit of a weird pharmacy here, too, where we try to encourage people to get off their medication and take less medication as well. So from my experience and anecdotally what I've seen, a lot of these medications may knock someone out, but don't necessarily promote a restful sleep and help you kind of recover
That is a good point.
through the night as well. So there are obviously other OTC products that we would recommend as well. CBD, our Gaspar's Best Sleep Perfect formula, some of these other things, which we'll cover in other episodes. What about some of the other common over-the-counter stuff that people take for these kinds of things in lieu of, controlled drugs, or if there, is an issue and they can't get that?
Yeah.
The Benadryls, things of that nature. What about those?
One that I don't know if it's commonly known, but certainly I think is very worthwhile to consider. That doesn't have any sedative properties, which is excellent for anxiety, is L-theanine. It's an amino acid. It works very well to calm a person. I've used it and recommended it to several patients here, and they're doing great on it. And they're in situations where their type of job. One of the patients is in law enforcement. They need to have something for anxiety, but they don't want to take something like alprazolam or something like that. They can't be drowsy. They don't want to have that in their system. So something like that, will work very well.
Yeah.
For just to help relax you or stress and anxiety. I know also you mentioned Benadryl, right? So Benadryl.
Yeah, just like we had said, hydroxyzine was an anti-allergy medication that helps with sleep. So Benadryl can do the same thing. Although I feel like ZQuil might be another option that would be more suited for sleep. It's a similar ingredient, but it comes in a liquid form, and it seems to work more effectively, specifically just for sleep. And these are non-habit forming as well.
Cool.
Right.
I think obviously the habit forming is something to consider and to talk with. I mean, a common theme here is there's a lot of differences. People all metabolize things differently. It affects people differently. There may be an inactive ingredient that someone might be allergic to, even some of that kind of stuff, which is completely
like
just another
Red 40
different.
is a very common
exactly.
allergy.
Sure.
Yeah.
So I think it's important to obviously work with your doctor, but your pharmacist can be a resource in that sense as well. So if you guys have any questions, our website is hbpharmacy.com or gasparsbest.com. You can always reach out to us and we can discuss those kind of things. So I think it's, important to have those conversations. Really, ultimately, that's what healthcare is all about. Working with patients, working with physicians to,
For sure.
Troubleshoot and see how we can, best help based on your particular circumstances.
Right. It never hurts to ask that question, whether you're talking to us, the doctor, all three of us together. That triad, we always talk about that. The three people working together to make sure that you get the best possible outcome. It's very important.
Sure. Cool. Well, thanks a lot, guys, and we'll see you guys in the next episode.
Sounds
Thank
good.
you.
I heard about it just on TV, magazines, on the internet, like all over the place.
all over.
For the longest time, I was extremely skeptical. Not because I was skeptical, or because of the association with marijuana and drug
it does
culture,
have a
that
stigma
kind
to
of
it,
stuff.
sure.
Like I can understand the anxiety and relaxing components like that, but then people start talking about CBD. Yeah, I mean that's really the right word for it. The stigma to it, and where.